Dizziness is one of the most confusing symptoms you can have because it can mean completely different things. And if you treat the wrong thing, it can make it worse. My name is Tanya, and I'm a certified advanced vestibular physical therapist. In this video, I'm going to break down the most common causes of dizziness and how to start figuring out which one you might have. And in subsequent videos, we will talk about how to treat each of these problems. Dizziness is a very vague diagnosis. It can mean spinning or vertigo, lightheaded, heavy-headed, foggy, off balance, or just a sensation of being off. And each of these can point to a completely different problem. The most common cause of dizziness is something called benign paroxysmal positional vertigo, or better known as BPPV. Symptoms of BPPV are almost always vertigo, a sense of the room spinning around you. These symptoms are triggered when your head changes position relative to gravity. So, lying down, sitting up, rolling in bed, bending over, or looking up are some examples. These changes in position will cause the crystals to move within your vestibular system, which will cause intense dizziness and vertigo, sometimes nausea and balance and walking problems. This is a mechanical issue in your vestibular system and is usually easily treated. It's important to note that this is a benign issue, meaning there is no long-term damage or problem. The second most common problem is a viral infection of the nerve that leads into your ear. We have several different viruses that are in our bodies that sit dormant. These viruses have likely been in our bodies since we were children or even from birth. Generally, some other virus, such as the cold, will present itself to our bodies, and it's that virus that will reactivate these dormant viruses. These reactivated dormant viruses will then attack the nerve that leads into the inner ear and can cause an abnormality that gives us symptoms. The symptoms associated with this type of problem are generally severe in the initial onset, such as vertigo, nausea, and imbalance, which then will settle over a day or two and become more of a lightheaded or off balance feeling. This type of dizziness takes a bit longer to treat, but it often leads to a return to how you felt before that happened. Other problems that cause dizziness could be migraine related. If you have a history of migraines, these can eventually interact with your vestibular system and lead to dizziness. These types of migraines are called vestibular migraines. Vestibular migraines do not always have migraine pain associated with them, but more often just the dizziness. Symptoms with these types of migraine are generally intermittent, meaning they come and go. Some days you will feel completely normal, and other days you're symptomatic. These symptoms tend to be more of a lightheaded feeling. You may have pain around the temples or at the base of the skull or top of the neck, and they could cause nausea. Medications that help migraines will help this type of migraine as well. Oftentimes, having a history of dizziness that is resolved can stimulate your anxiety and stress pathways in the brain, and a symptom that reminds your brain of the earlier event can trigger similar symptoms. These are considered anxiety driven symptoms and can come with a fear of movement, difficulty with visual motion, such as walking through a grocery store, and occasionally panic attacks. This type of dizziness is called persistent postural perceptual dizziness. While it's a little harder to address, a trained vestibular physical therapist will know what to do to help. Many times, seeing a counselor to determine what event triggered the return of the symptoms is also extremely helpful. Lastly, there is a dizziness that is associated with more rare causes, such as brain abnormalities. Things such as stroke, brain tumors, or other neurological injuries can cause dizziness and imbalance. The main difference is that most of these problems tend to come with other issues, such as difficulty moving an arm or a leg or both, speech problems, significant visual issues like double vision, or abnormalities in walking. If this type of dizziness is what you are experiencing, it is very important that you get to a doctor immediately and have testing performed. The faster you are treated with neurological injuries, the more likely you are to recover better. What's been presented here today is not an all inclusive list. Concussion, visual issues, or structural changes in the vestibular system are also possible causes. There are other things that we won't address that may be causing dizziness, such as blood pressure, low blood sugar, or medications. These are just some of the more common causes of dizziness. And it's important that you see someone that is specially trained to diagnose and treat these disorders. Any physical therapist is not going to be able to treat vestibular disorders. You will need a trained vestibular physical therapist. Again, not all dizziness is the same. I have created this channel for you. Over time, there will be videos that go into further explanation and treatment ideas. So click that button below and subscribe so you will know when new videos are posted. Thanks for watching.